anyway, so what we're going to do for you today is we'll take these x-rays and get an idea on whether you have cavities or not.
Okay.
You know, ideally, we should be able to see if they're in between your teeth or not. A lot of times, if you haven't been to the dentist a long time, is that right?
Yeah.
So, you know, we should be able to tell together on whether you have little small cavities or what they call incipient lesions. Sometimes people will have cavities starting in between their teeth, but they aren't quite there yet.
Yeah.
So what we're going to do is detect that.
Okay.
And then we'll look together and determine, you know, what do I really need. Okay?
Together. Okay. Good job.
Okay, so here we have our digital images here, and what we have is the right side of the mouth over here, the right side, and here's the left side. Basically, these are the molar region, so these x-rays right here don't show the front teeth, but you could take x-rays or digital x-rays of the front teeth also. What we always look for is contrasting in the image itself. So, for example, I can change that to whether it be darker or lighter, or in essence I can, if I need to look at it closer, I can make the image much larger and take it out and blow it up to that size. So by enhancing the image, it allows me to look for areas on her teeth that she may have some cavities. So in this particular x-ray, you know, we can go much darker, but sometimes that's not better. I can see when it's lighter, sometimes I can see areas on the teeth where there's tartar buildup, or areas where you can tell that they haven't flossed and they have buildup. And then we look for small areas where they potentially have cavities. For example, on this x-ray here, see, I can see a little shadowing in between the teeth, and that is what they call an incipient lesion, or it could be a cavity depending on how far it goes into the tooth. So when I look at her images, sometimes looking at from further away is not necessarily, that's looking further away is actually better, because you can see the image from a distance. You can see more contrast rather than having it so large. So that's what digital radiography does. It allows you to be a good diagnostician through good technology, and it lets you give better treatment to your patient. And that way your patient feels more secure about what is being told them, and then giving them good treatment. So that's what technology and dentistry is doing today. So now I'm going to take a look in our mouth here and see if what we see on the x-ray is similar to what we see in the mouth. Okay, Miss Hannah, let's take a look here. How old are you, Anna? 15. 15?
16.
16? Let me get that last one. Okay, here we are. Now, if you want to go ahead and get that up and going for you. And we basically want to just take a look around the whole mouth, not just at the teeth. What we want to do is look at everything. We want to look at all the soft tissue areas underneath the tongue. We want to look at the lips, all around the cheeks, the roof of the mouth, because what you're looking for is any kind of lesions or anything that makes you suspicious of oral cancer or anything like that. Go ahead and bite together. And another thing you can do is, just through the occlusion of the patient, you can determine if there's any constriction of the palate, or if there's any indication that the patient may need orthodontics and things like that. In her particular case, it looks like she has nice teeth. She's got a pretty smile. And I'm just going to take a few pictures here so that we can see if there's anything going on. So these are some images of the back teeth, just to kind of correspond with the x-rays. That's okay. Okay, so that's just kind of looking around with the camera. Allows me to see actually closer. Yeah, go ahead and hit that. Yeah. Well, allows me to see things closer with a camera, and you can see it a little bit better than the naked eye. And then I can show her a couple of those pictures that correspond with her x-rays. Generally speaking, she has beautiful teeth. She takes pretty good care of them. It's evident that she needs a cleaning, but you know, nothing for her to worry about actually, except for some routine preventative care. Okay, let's take a look at these images. Okay, that's all right. So this is an example of our intraoral camera. And you can see basically on this image right here, you know, it looks all healthy. You know, and this is what all your teeth look like. They all look pretty healthy. Let's look at your images again. So now we can bring up your images. And what I see in your particular case is I see an area where you're going to need a couple fillings in between your teeth, kind of like what you've been told before, up on the upper right area. Okay, and then outside of that, you may have some areas that you need to floss and keep them a little cleaner, but really, you don't need a whole lot of fillings. You need a little bit of care, but if you maintain it, then you know you may never have to have a whole lot of dentistry in your life. So, okay. So there we go.